Spirometry. Spirometry looks at how fast and how much you can exhale in one breath. It takes two key measurements: the volume of air you can exhale or expire in the first second of breathing out, and the total volume you can expire. These tests can reveal lung problems before symptoms develop. Spirometry can be used to monitor illnesses and assess your health before an operation. It is also used to diagnose the cause of respiratory problems, such as cough or breathing difficulty, including chronic obstructive pulmonary disease. If you smoke, you may be advised to stop 24 hours before the test. You may also need to avoid alcohol, exercise, or having a heavy meal a few hours beforehand. If you are on inhaled medication, you may be asked to stop using it before the test. In addition, wear loose clothing that will allow you to breathe freely. Someone with normal lungs breathes out quickly in the first second, then exhalation slows. Someone with a restrictive problem follows the same pattern, but reaches a lower maximum volume. Someone with an obstructive disorder also has a low maximum volume, but breathes out slowly and takes longer to reach that maximum. So, self-help measures: we should maintain a healthy body weight and quit smoking. Globally, COPD is underdiagnosed by up to 93%. Taking the test: a clip is placed over your nose. The clinician then asks you to exhale as hard and fast as you can 3 times into a mouthpiece connected to the spirometer. Repetition is needed to get a reliable reading because the results are dependent on exactly how you exhale. The test may be done again in 15 minutes after a dose of inhaled medication. Sometimes the clinician will look at the pattern of flow rate during breathing out. The shapes produced help distinguish between restrictive and obstructive disorders. The test measures your breathing rate over the course of one exhalation. Your results are presented as graphs and compared to those predicted for someone of your age, sex, and height. This reveals whether your airways are normal, obstructed, restricted, or a combination. Obstructed or obstruction could be due to asthma or COPD, which narrow the airways. Inhaled medication often improves the result. Restriction could be due to obesity or kyphoscoliosis, a spine abnormality that prevents the lungs from moving normally. Thank you for your attention.
Let's now go to pathology. Let's discuss phlegm. Phlegm is a very important and common internal pathogenic factor. Like blood stasis, it is also potentially the cause of serious diseases such as cancer, heart disease, and stroke. Phlegm is at the same time a pathological condition and an etiological factor. In fact, phlegm that is retained over a long period of time becomes itself a cause of disease. The main cause for the formation of phlegm is spleen deficiency. If the spleen fails to transform and transport body fluids, these will accumulate and change into phlegm. The lungs and kidneys are also involved in the formation of phlegm. If the lungs fail to diffuse and make fluids descend, and if the kidneys fail to transform and excrete fluids, these may accumulate into phlegm. The essential signs of phlegm are a swollen tongue body, a sticky tongue coating, and a slippery or wiry pulse. Other symptoms may include a feeling of oppression of the chest, nausea, a feeling of heaviness, a feeling of muzziness or fuzziness of the head, and dizziness. Other signs of chronic phlegm are lack of luster of the eyes, dark eye sockets, corners of the eyes have very slight cracks with exudate, sallow complexion, swollen body, puffy face, obesity, greasy skin, sweaty external genitalia, axillae or palms and soles, enlarged fingers and toes, thick thumbs. For treatment, general points for phlegm are REN 12, REN 9, spleen 9, stomach 40, REN 5, and bladder 22. Essential manifestations of phlegm are tongue and pulse, swollen tongue body with sticky tongue coating, slippery or wiry pulse. For other symptoms, a feeling of oppression of the chest, expectoration of phlegm, nausea, a feeling of heaviness, a feeling of muzziness of the head, and dizziness. Thank you for your attention.
Let us now talk about stomach 16, breast window. Located at the third intercostal space, fortune lateral to the anterior median line of the chest. Chi and breast milk pass into the breast at stomach 16. Stimulates and regulates the production of breast milk. This area near the breast and the heart is where a mother would hold a child to nourish and soothe them. This point can be used to restimulate the urge to give or receive comfort and nurturance. Indications for milk production, mastitis. Needling, transverse, oblique insertion laterally or medially along the intercostal space, 0.5 to 0.8 sun, or transverse insertion superiorly or inferiorly along the channel. Caution, deep or perpendicular insertion carries a substantial risk of puncturing the lung. Actions, alleviates cough and wheezing, benefits the breasts. Combinations, for swelling of the lips, we combine stomach 16 with liver 3. For breast abscess, chills, and fever with shortness of breath, restless sleep, we combine stomach 16 with kidney 23. So, stomach 16 is helpful for milk production as it is through this point that chi and milk pass into the breast. Thank you very much for your attention.
Okay, so this time we'll talk about another liver pattern. This time we'll talk about deficient yin causing liver wind. Let's begin. So this is due to the deficiency of yin fluids being unable to nourish the sinews and vessels. So for the clinical manifestation, we have muscular twitching, dizziness, tinnitus, tidal fever, red cheeks, dry mouth and throat, thin body, red tongue with scanty fluid, and thready and rapid flow. Now, the key symptoms of it is wind stirring pattern like muscular twitching, dizziness, and so on, and yin deficiency pattern. Okay, so this pattern is mainly caused by the depletion of yin fluids at the late stage of warm diseases or chronic disease, leading to deficiency of yin fluids, failing to nourish the sinews and tendons. So there's the graph for that. Okay, so let's have the next slide. This time, ascending liver yang generating liver vein. This pattern will always have its root in either liver yin uh, deficiency or liver blood deficiency. There will be minor variations in some of the symptoms depending on whether it is liver yin deficiency or liver blood deficiency. That is the underlying cause. Furthermore, there are differences between liver blood deficiency leading to the pattern ascending liver yang generating wind and the next pattern liver blood deficiency generating wind. So the former is a combination of a deficiency and an excess pattern, whereas the latter is an exclusively deficiency pattern. So this means that the symptoms will be milder and less extreme when it is a purely deficiency pattern. Okay, so again, the key symptoms that we can see in the patient is the dizziness, the tremors, insomnia, and dry eye. Now, we have to calm the liver wind and nourish liver yin and blood for as our treatment sprint. Now we use the acupuncture points liver 3, liver 8, do 16, do 20, gallbladder 20, urinary bladder 18, and spleen 6. Now if there is liver yin deficiency, we add kidney 3, kidney 6, ren 4, and urinary bladder 23. If there is liver blood deficiency, we add stomach 36, ren 12, and urinary bladder 17. For the needling technique, we do the draining technique on day 16, day 20, and gallbladder 20. Even technique on liver 3 and UB18, and the tonifying technique on the rest of the 4. So why these points? Well, liver 3 and UB18 nourish liver yin and liver blood and extinguish liver wind. Liver 8 and spleen 6 nourish liver yin and liver blood. Do 16, gallbladder 20, and do 20 extinguish internally generated wind, especially when the symptoms affect the head. Now, kidney 3, kidney 6, REN 4, and UV 23 nourish kidney yin. Kidney yin and liver yin have a common root. Stomach 36 and REN 12 together with spleen 6 tonify the spleen and thereby the production of blood. And lastly, urinary bladder 17 helps in nourishing the gut. Okay, thank you so much for listening.
Inquiring sleep. Sleep is a complex biological process that likely has multiple purposes. This process involves virtually all the organs and systems of the body. The most important organs related to sleeping are the heart, liver, kidney, spleen, and stomach. There are three main types of sleep disturbance. Insomnia. This may present as difficulty falling asleep, easy waking from sleep, or inability to sleep at all through the night. It is often accompanied by excessive dreaming. Insomnia occurs in many illnesses. If insomnia is accompanied by palpitation of the heart, restlessness, and a red tongue with little coating, it is due to insufficiency of heart yin. Difficulty falling asleep accompanied by palpitation of the heart and lumbar and knee aches and weakness is due to disharmony between the heart and the kidney. Easy waking from sleep accompanied by palpitation of the heart, reduced appetite, a pale tongue, and a feeble pulse is due to insufficiency of both the heart and the spleen. Insomnia accompanied by much sputum and a yellow and greasy tongue coating is due to phlegm heat disturbing the heart. Awakening with fright from sleep, accompanied by dizziness, chest tightness, timidity, restlessness, vomiting and nausea, and a bitter taste in the mouth, is due to accumulation of phlegm in the gallbladder. Excessive dreaming. The causes and significance of excessive dreaming are generally similar to those for insomnia, and their treatment is also similar. Somnolence, accompanied by fatigue, dizziness, blurred vision, heaviness in the limbs, chest tightness, and the greasy tongue, is due to phlegm dampness invading the spleen and preventing pure yang from ascending. If accompanied by extreme fatigue, cold aversion, cold limbs, and an indistinct and thread-like pulse, it is due to insufficiency of heart and kidney yang. Postprandial somnolence associated with a weak constitution, anorexia, shortness of breath, and weakness is due to deficiency of spleen qi, so that pure yang does not ascend and fails to nourish the head. Normal sleeping depends on the function of the heart. The heart governs the blood, controls the blood vessels, and houses the spirit. The spirit is the external manifestation of the body's vital activity. Spirit is also the mental activity, which includes conscious and subconscious activity. During the daytime, the yang qi is abundant and the spirit is active exteriorly. One will therefore awaken and become active. During the nighttime, the yin qi dominates. The spirit is stored interiorly, and if it remains peaceful and calm, there will be sleep. The heart qi and yang promote the activities of the spirit. Heart blood and heart yin are the substances that nourish the spirit. Therefore, changes to the heart qi, yang, blood, and yin will affect the status of the heart spirit. The heart is thus the major organ directly related to sleep. Liver, the organ that regulates sleep. The liver stores the blood, ensures the smooth flow of qi, and houses the ethereal soul. Sufficient liver blood can help anchor the liver yang, which prevents it from rising up and disturbing the spirit. Liver blood also has the function of nourishing the spirit and ethereal soul. If the liver blood is insufficient, the ethereal soul will not be anchored and the individual will suffer from dream-disturbed sleep. Kidney, the congenital root of human life. It stores essence and produces marrow to fill up the brain. The brain is the sea of marrow and houses the primary spirit. It is the organ of spirit, consciousness, and thinking. Kidney yin and kidney yang are original yin and original yang. Kidney yin is the foundation of the yin fluids of the entire body. Kidney yang is the foundation of the yang qi of the entire body, which provides warmth and promotes growth. The kidney is the organ that ensures that yin and yang are balanced. It is therefore the organ that ensures normal sleep. Spleen and stomach, the acquired root of human life. The transportative and transformative functions of the spleen and stomach provide basic nutritional substances to keep and maintain sleeping activity. Thank you for your attention.
Let's now go to interview and history-taking strategies. Let's discuss social history part 2. For diet, time limitations usually preclude eliciting a comprehensive diet history during the initial health history. Unless management of the patient requires immediate dietary intervention, the patient can be asked to keep a record of food and beverage intake for a typical week, not during vacation or over a holiday. Less extensive diet histories often grossly misrepresent the patient's usual dietary practices and do not facilitate effective clinical management. Ask the patient to record the date, time, type, and the amount of food and beverage consumed. Important additional information to be recorded includes cultural or religious practices that influence dietary practices, specific quantities. Examples, did the patient have a 6-ounce cup of coffee or 16-ounce mug? How food was prepared? Was it broiled, fried, baked, or prepared some other way? Was it prepared at home or purchased commercially? The use of salt in the preparation or addition as a seasoning. The use of oil. Was oil used in preparing the food? If yes, specific type. Some oils are very high in saturated fat and trans fatty acids. For the type of beverages you consume, note whether they are caffeinated, alcoholic, or artificially sweetened. If at all possible, ask the patient to return the completed diet history to your practice site before the next visit so that you may review it. If the appropriate patient privacy and confidentiality health information safeguards are in place at your institution, you may be able to receive this information in electronic form. One more caveat: dietary practices are influenced by many factors. Some are obvious, as with socioeconomic status. Others are more subtle, as is often the case with many elderly patients living alone. They may have the means to purchase and prepare an adequate diet, but because of loneliness, may not do so. Eating is a social experience for most people, and elderly patients living alone in particular are at risk for nutritional deficiencies. For exercise, note intensity, duration, and frequency, which factors influence the patient's participation or non-participation in regular aerobic exercises like work, homemaking, childcare responsibilities, access to safe recreational areas, or physical limitations such as obesity, arthritis, or angina. Note sleep. Note the usual number of hours per 24-hour period. Does the patient engage in rotating shift work, which can alter sleep wake patterns? Does she or he experience difficulty falling or staying asleep? Does she or he consume anything before retiring that may interfere with sleep, such as caffeinated beverages, chocolate, or diuretics? Is there any evidence of sleep apnea, such as snoring, excessive daytime sleepiness, or feeling fatigue upon awakening? Is the patient awakened from sleep by pain or by the need to void? Lastly, for sexual history, traditionally the sexual history has focused almost exclusively on assessing the patient's feelings about and satisfaction with his or her sexual performance. For example, it includes the number and type of partners, frequency of intercourse and other sexual practices, type and use of contraception, ability and to achieve and sustain an erection, ability to achieve orgasm, and overall satisfaction. These are important questions and allow for identification of treatable conditions such as erectile dysfunction. It is also useful to conceptualize sexuality as encompassing a broad range of expressions of intimacy and caring, such as holding, cuddling, and touching. Thank you for your attention.
Okay, so let's talk about acupuncture for emergencies. It's then the second part of bleed. Okay, so if there's bleeding from the stomach, we use UB17, UB21, PP6, and stomach points. For foot therapy, we chop garlic into mud or paste and apply it on the bottom of the foot, fold with gaze, and eat for several hours. Mm. Now, press cabbage to collect the juice and add a little white sugar in it. Drink the mixture every day, 30 ml each time. You can also drink it before each meal every day, 100 to 200 ml each time. Use watermelon cane, 100 grams, and lotus flower, 30 grams. Add both to water and cook as a soup. Drink the extract twice a day. Now, if there's bleeding in the intestine, use the points UB57, kidney 7, do 1, herbi point, and use moxibustion on do 20. For the folk therapy, we dry several carrot leaves naturally in the air, then grind them into powder. Drink the powder 6 grams each time, twice a day. Burn eggplant with stems into ash, then grind into powder. Drink 9 grams of the powder. Swallow with cooking wine, 20 ml, and repeat for 1 week. So we can also use 30 grams loofah, base black in color, and 30 grams sulfurate. Mix the materials and grind them into powder. Drink the powder twice a day, 6 grams each time. Now, another 90 grams lufocaine. Bake 90 grams of lufocaine until black in color. Grind into powder. Drink it twice a day with the addition of a little cooking wine. Material. Another one is 1 cup watermelon juice and 20 grams of brown sugar. Mix them and drink the mixture 3 times a day. So if there's bleeding from the urinary system, use the points UB23, UB28, spleen 9, spleen 10, and spleen 6. Now, use the 60 gram Malgen herb, and 60 grams, excuse me, shan he cow. Cook in 1000 ml of water until the liquid left in the pot is about 600 ml. Now, drink 100 ml of the liquid extract every 2 hours. Now, the full therapy, use fresh celery to prepare juice. Drink the juice 3 times a day, 40 ml each. Use 15 grams of grape root, and 15 grams of white sugar. Now add the grapefruit to water and boil for 1 hour. Collect the extract and mix with the sugar. Drink the extract mixture every day. Repeat for several days. Now, um, another one is 100 ml of sugar cane juice and add 15 grams of peach kernel. Add the peach kernel to water and cook as a soup for 60 minutes with the sugar. Mix with the sugar cane juice. Drink it once or twice a day for several days. Now, for all kinds of bleeding, do not forget to use the spleen pen point. Thank you so much for listening.
Let's discuss heart blood deficiency as a pattern of erectile dysfunction. Clinical manifestations: impotence, premature ejaculation, palpitations, dizziness, depression, insomnia. Tongue is pale, pulse choppy. Treatment principle: nourish heart blood, calm the mind. Points: heart 7, 5, bladder 15, SI3 with bladder 62, do 24, REN 15, 4, 6, 3, bladder 34. All are needled with reinforcing method. Heart 7, 5, and bladder 15 tonify the heart and calm the mind. SI3 with bladder 62 open and regulate the governing vessel. Do 24 and REN 15 calm the mind. REN 4 and 6 will tonify chi and blood and calm the mind. REN 3 and bladder 34 will treat the genital system. Thank you for your attention.